Welcome to the briefing for the CT2 Simulation Day. For 2011, the venue will be for all the simulation days at the Royal Preston site. The dates are the 30th of August, 14th of December, 21st of December. As many of you will be aware, simulation is now becoming ingrained within medical education. Many of you will have experienced it at undergraduate level or the CT1 Practical Skills Day. We are undertaking a simulation in all facets of medical education, whether it be at primary care level, surgical level, or as a physician. It can take the form of very simple simulation where you have one-to-ones with simulated patients breaking bad news, improving consultation skills, to highly advanced simulation undertaking practical procedures such as keyhole surgery or managing acutely ill patients with advanced simulation using highly sophisticated mannequins. To that extent, this simulation day will take a full day of training. It is split into two halves. The advanced simulation on medical emergencies. We are not looking at your ability to deliver care yourselves, but how you respond within a multidisciplinary team, roles of clinical leadership, communication skills, etc. The virtual ward round focuses on the ability to discuss the findings of an acute admission with the patient, ability to develop management plans, and to understand the outcomes of investigations. The days are aimed at you to allow you to explore the way you perform within clinical settings and to look at how you and your peers perform and whether there are ways that you can improve your clinical capabilities. There are 32 students per day and you're split into two groups of 16. The advanced simulation station takes place in a purpose-built simulation lab which can mimic a theatre, a ward area, a resus area, and A&E. The mannequins which you'll be involved in interacting with can have heartbeats, breath sounds, can talk to you, can respond to therapeutic interventions. They can mimic a fit soldier, an 80-year-old woman, a cigarette smoking, alcohol drinking lorry driver who is middle-aged. The focus will be on common medical emergencies which you will have to tackle on a day-to-day basis, and there will be about 4 clinical scenarios you will be involved in. It is important that you immerse yourself within those simulation roles. You will have facilitators in the room with you. They will be able to then sit down and review your performance as a team with video playback, and the debriefing is as important as the clinical interaction you have with the mannequins and each other. You will be asked, therefore, to provide constructive, supportive, analytical, objective feedback on yourself and your peers. Therefore, it is hugely important to be interactive in this day to optimize the outcomes with regards to learning for you and your peers. The virtual ward round consists of clinical scenarios. The patients will have attended MAU, had an overnight stay, and you will be seeing them post-take. You will have one facilitator per station and a simulated patient or a practical procedure to undertake. The clinical scenarios that you will undertake with a simulated patient are orientated with regards to communication, to understand the outcomes of investigations and formulate effective management plans. You will have the ability to feedback with your facilitator during these periods. The practical skill stations are linked to the clinical scenarios and help consolidate skills that you will have learnt during the CT1 practical skills days and onwards from then within the real clinical environment. The virtual ward round clinical scenarios will last 15 minutes each with the simulated patients, and there will be 30 minutes per practical skill station. Feedback, as I said, will be given through these stations, and there will be the ability to fill out simulated assessment-based forms. This is just a rough layout of what the virtual ward round timetable will look like. The virtual ward round will take about 2 3/4 hours. Therefore, there are rest stops for you to have natural breaks and to get a coffee or a tea during these periods. During the practical skills sessions, you will have half an hour, as I've said, the TIA, the pleural fusion, the chest pain, CKD, and headaches will be your clinical scenarios which this time you'll be involved in. To that extent, during both the acute medical scenarios as well as the virtual ward round, you will have the ability to undertake simulated based assessment forms as well as receiving a certificate of attendance. You can add all of these to your e-portfolio personal libraries and link them to practical competencies that you need to undertake as simulated competencies as proof of ability to undertake procedures and also communication skills, etc. We do ask that you therefore allow us to have constructive feedback at the end of the day so we can, as time goes on, improve on the day's training for your peers to come. Finally, can we ask you to be punctual, because it is a very tight schedule for the day and lateness actually impacts on your colleagues' learning experience. We will allot you to groups and we'll hope that you will stay in the groups throughout the whole day. We will ask you to be interactive and constructive in the day's training. Please give feedback to us. As I've said, at the end of the day, it's the only way we can improve on what we're trying to deliver for you. We hope you have fun. It is a different learning experience to sitting in front of a computer screen or a whiteboard and being lectured to throughout the day.